My name is Prabodh Palit. I'm from Bombay and I am a patient of lung cancer. It's stage 3 and I needed to go through treatment for the cancer, obviously. So I went to the leading pulmonary specialist in Bombay, Dr. Udwadia, and we started treatment in Bombay to go through the Hinduja hospital, where I went through chemotherapy. And I was supposed to then go for the next phase. I was supposed to do radiation as part of the treatment for the tumor. And the normal course of action would be to go for the radiation, which was popular in Bombay and rest of India, is IMRT, which is the photon technology. But the downside with photon technology is that it sort of affects the other parts of your body or where the tumor is. And in my case, my tumor was close to the heart, and there was going to be overlap on the heart. So that it was going to be a situation where, besides the scarring of the lungs, I was going to have a situation with having a strain on the heart. And at that point, I was talking to friends and people about how one tries to prevent this. And a person told me, some friend of ours told me that there was a doctor in Bombay who had been airlifted to Chennai to go through a proton therapy. So that's when I started researching proton therapy, and I researched it very thoroughly with associates, friends in Tata Memorial Center and John Hopkins. A lot of information through John Hopkins in the United States, and Memorial Sloan Kettering, and even Dana-Farber. And all of them, to be honest, were not but very clear about the efficacy of proton. And then eventually I connected with Dr. Ratan Rai in Chennai, who introduced me to Apollo Proton Center, and I started discussions with John Chandy, who also then introduced me to Dr. Srinivas Chiliguri. And we did a lot of negotiations on the efficacy of the technology, on the hot spots and the radiation and how it would affect the body. And the main issue was the amount of the radiation that would be spill over from the actual tumor. And then after a thorough research of almost 6 weeks, we arrived at the conclusion that proton therapy would be the only and the best solution for me. Although there are two issues here, and one is of course the cost, which is a lot more than the standard radiation. But at the same time, due to COVID, it meant traveling out of Bombay and coming to Chennai, which is the only center in India which has proton therapy facilities. And it's a very large a building that has been built recently, and it's extremely complicated technology, and very few in Asia for that matter. In fact, there are not those many machines in the world. And so then we decided, and my radiologist in Bombay was Dr. Kannan, who also was of the opinion that if possible I should come here and do it. And then we came here with, after talking extensively to Dr. Srinivas, and who would be my consulting doctor, and to, of course, John Chandy, we came here to the Apollo Proton Center, and it was extremely impressive building. The infrastructure is amazing. It's world standard. It's like an international hospital. It's absolutely brilliant, and it's nothing like any hospital I've seen anywhere in the world for that matter. But leaving the infrastructure alone, which is of course mortar and bricks, what makes a good hospital is the people. And the people here on both sides, the scientific side and of course the administrative side, are absolutely gold standard, world standard, brilliant people. Very slick. It's a very well run operation, and the doctors are probably the best doctors in the world. Dr. Srinivas and his team with Rishan, and Dr. T. Raja. Dr. T. Raja has 100 patients who is teased for cancer, I'm told, and he's got a team of 4 doctors with him who are also absolutely amazing. So, and then of course the Proton Center, which has got the technicians and the people like Dr. Karthikan, who does he's a PhD in physics, who does planning of the radiation, which is a very, very, very important part of the whole radiation process, is how it is planned so that there is no collateral damage to your organs. And of course, at the end of the day, it is the benefits of proton, or the precision and the low side effects. And then there was also, of course, the chemotherapy aspect, which I did also simultaneously for increasing the efficacy of the radiation, which was again managed by Dr. Raja's team, and which was absolutely seamless. So all in all, it was a very good experience, and hopefully the treatment works. And I'm on my way back now to Bombay after having an extremely pleasant stay in Chennai. I'm very, very fond of Chennai. We were here for 2 months and stayed in Chennai and traveled up and down. But this is the best experience I've had of a hospital, and very thankful for everyone over here.